And I just wanted to show that dengue affects differently in different parts of the world. Next one. And this shows that in Africa, in Africa there is a lot of dengue, but the previous one. Though there is a lot of dengue in Africa, Africa has no DHF whatsoever. So they don't have even a single patient with DHF. You have 5% of DHF. Africa doesn't even have a single patient with DHF. My country has 35 to 40% DHF. So it's different from place to place. Next one. The next one. So the most important thing we have told your doctors is that it is important to differentiate between DF and DHF. These are two different conditions. One will not become the other one. The DF will not become DHF simply because your doctor did not manage you well. However, bad you manage, DF will never become DHF. Next one. And these are two different conditions, and in DF there is no leaking of plasma. Next one. And but in DF, now a lot of people tend to think that if you have bleeding and dengue, that is dengue hemorrhagic fever. It is not so. In DF also you can have bleeding into skin, bleeding from gums, bleeding from nose, bleeding from vomiting blood, passing blood and so on. So just bleeding, dengue with bleeding is not dengue hemorrhagic fever. With the fluids by identifying the critical period and giving specific amount of saline and other fluids.
इसे अगर आप देखें तो जो fluids हैं उसका bolus दिया गया.
This is her X-ray. Her X-ray is not like the other boy's X-ray. That other boy's X-ray was full of fluid in the lungs, but her X-ray is not like that.
इस X-ray में आप देखें fluid इतना ज़्यादा नहीं है. जैसे कि पहले X-ray देखा था जिसमें पूरी छाती जो थी.
Yeah, both are sort of similar patients, but now with the better management, she is not. So some hospitals still think that when the platelets are low, platelets need to be transfused, and also a lot of patients are asking. We asked the doctors why they are giving platelets, and they said that patients are asking for platelets, and if they don't give, they will be blamed. Therefore, they are giving.
यहाँ पे हमने देखा है कि प्लेटलेट्स पे बहुत ज्यादा तवज्जो दी जा रही है और प्लेटलेट्स लो होने की कम.
Because if she go home, somebody will take her to hospital, and some other hospital might give her platelet transfusion. So I kept her for one more day in hospital until the platelets went up. The next slide.
Ladies and gentlemen, we welcome the Honorable Chief Minister, Mia Shahbaz Sharif, into the hall. You're welcome, sir.
Right. So, though he came like that, in 3 days, this is his photo. Next one. This is also his X-ray when he came. Next one. This is him after 3 days of being in hospital. So though he came like that, he also recovered by this treatment regime. The next one. So if you one of the things that we have told is that one of the ways of learning the mistakes that we make in the learning process of managing patients is that solution called dextran. That this slide actually is a slide which I showed our Secretary of Health to the Ministry of Health in Sri Lanka a couple of years ago, and we took time before we got down dextran, and I should congratulate the Ministry of Health of Pakistan. And since we told them that I think in a very short period you have got a stock of dextran in your hospitals now, so this is a very useful thing. It's kind of a important treatment to manage the dengue patients. And we are just about, today we are meeting some doctors and discussing about the use of this. The next one. We have also recommended that you should start having some dengue walls or the dengue high dependence units, which are coming up in Lahore. I want to show some pictures. The next 3 slides are pictures of the dengue high dependence unit I have in Sri Lanka. It's not a very sophisticated thing. It doesn't really need many big equipment, but you need a multi-para monitor. Next one. This shows that there is a monitor where you can check the patient's pulse and blood pressure and so on. And also a thing called an infusion pump where you can give IV fluids very carefully in a measured way. And if you see that these dengue high dependence units are not things where you have a lot of mosquito nets. Actually, when the patient starts leaking and when you put a patient into a dengue high dependence unit, mosquito nets are not so important because those patients will not transmit the disease. The disease transmission only occurs when the patient is having high fever during the first phase or the fever phase. The next one. This is again another picture of my dengue high dependence unit in my ward in Sri Lanka. You can see that we prevent the mosquitoes from coming into the dengue high dependence unit by keeping the windows closed and with air conditioned so that mosquitoes won't come in. The next one. It's another picture of a dengue high dependence unit. Next one. So about patients with complications, we have also told that the patients with complications also can be managed. I just wanted to tell you that even a very complicated patient, of course, their survival is not 100%. There are things that you can try and do. The next one. And this is this patient. Now this patient, though he's unconscious and he's not able to breathe, his platelet count has now started coming up because it's only down during the critical period, and during the next period his platelets improve, his liver functions become better, platelets improve, but his liver functions have still become worse because he has been having prolonged shock and also fluid overload during the bad period. The next one. And this patient has had both prolonged shock and fluid overload. The next one. So we tried our best to manage this patient and by managing a more difficult patient by managing complications. We have told your doctors, we have discussed, we have had seminars where we have told your doctors how to manage complicated patients. When you manage a complicated patient, the survival is not guaranteed, but this boy, we did all these things. Manage this patient complications, various methods.
ये जो पेशेंट का जिक्र मैं कर रहा हूँ, इसमें जब ये हॉस्पिटल आया तो उसकी शॉक के अंदर जो मैनेजमेंट थी उसके अंदर इन पेशेंट्स का करेक्शन ऑफ एसिडोसिस और इनका जो कैल्शियम लेवल कम हो जाता है, ट्रांसफ्यूजन की जरूरत पड़ती है, तो ये पूरा प्लान और स्कीम होती है जिसके तहत हमने ट्रीटमेंट किया.
So as a result of this, this was Saturday afternoon. He was in the ventilator, but he was able to open his eyes by Monday night.
सैटरडे को ये वेंटिलेटर पे था और मंडे शाम तक इस पेशेंट ने आंखें खोल ली और हमने इसे वीन ऑफ कर दिया.
Then next one. We were able to take most of his fluids from his lungs by giving injections of Lasix and so on.
लेसिक्स के हमने टीके दिए ताकि इसका जो फ्लूइड है बॉडी का वो बाहर निकल सके, पेशाब आवर ये दवा खिलाती है.
He was able to sit up though he was unconscious before. This was a picture of him on Tuesday. And this is his lungs after all the fluids taken away. And the next one. And he recovered. Though he had such a difficult condition, he also recovered. The next one. That is also him recovering.
अब आप देखें पेशेंट रिकवर होने के बाद बिल्कुल नॉर्मल लग रही है.
The next one. So this is putting my initial slide again. As you know that we have told the people that it's important that you identify this disease. We have told the best case management, how to hospitalize and so on. The rest is of course how you keep this going for the rest of the period. I think my team leader, Dr. Hasita Tisera, will tell about number 5. Thank you.
Thank you.